afternoon. And there we are. The meeting is in progress, and so is the recording.
May 16th, 2020.
Well, I'd like to welcome everybody. We're so delighted with today's turnout for this session, including our distinguished panel, our Health Foundation trustees, and various community leaders. Thank you for attending. Understanding that stable housing is essential to overall health, the Health Foundation is invested in the pursuit we have invested in the pursuit of affordable, stable housing through research, grants, and convenings for several years. Most recently, we invested $1 million to ensure that our neighbors remain stably housed despite the impact the pandemic is having on their finances. There has been much discussion about affordable housing in our community over the years, and we are delighted to provide this opportunity to talk directly with the experts in the field to add to that discussion. The current Williamsburg Health Foundation strategic plan includes a focus on advocacy for affordable housing. Your presence with us today truly underscores the importance of and interest in this topic. Before we get started, I'd like to just cover a couple of housekeeping things. I'd like to request that participants who are not going to be speaking immediately in our session this afternoon, that you mute your audio and turn off your video settings so that we might be able to better focus on our panel members. If you have questions during the discussion, please feel free to type those into the chat function, which I will be monitoring throughout the meeting. Toward the end of the program, we will ask the questions from the chat and also invite everyone to unmute your audio and turn on your video so that you can ask questions or comment directly. Now I'd like to hand the meeting over to Kira Cook, who will be moderating our discussion today. Kira?
Thank you, Carol. So I'd like to jump right into the content of the program, but before I do, I'll talk a little bit about the Health Foundation's interest in housing beyond what Carol just mentioned. So overall, this is really a healthy and wealthy community, although those favorable averages mask some significant disparities in the health of our neighbors and community members. However, there are some areas where the data in our community illustrates some clear unmasked issues, if you will, that stand out. And one of those areas is affordable housing. The connection between housing and health is truly foundational. And so that connection between housing and health is really related to three domains, if you will. The first has to do with the physical condition of housing. Is the housing where our neighbors are staying safe, lead-free, free of mold, free of violence, that sort of thing. The second domain, if you will, is the built environment. Are there sidewalks around so people can easily move around the neighborhood? Are there grocery stores nearby, playgrounds, that sort of thing? Does it create a sort of healthy neighborhood environment? And the third domain, which is really primarily our interest today, is affordability. Is housing so expensive that a minor financial setback leads to housing instability and frequent moves, which are unhealthy and can, of course, sometimes lead to homelessness? Or is housing so expensive that even if stably housed, the people in that household cannot afford healthy food or medication that's needed, and they have to make tough choices on a monthly basis just to stay housed? So because the need for affordable housing is glaring in our community and the issue is so large that it exceeds the resources of any one entity in our community, the Health Foundation has focused its efforts around housing advocacy. And as Carol alluded earlier, we have commissioned studies, we have presented to planning commissions to support comprehensive plans in the localities that include a commitment to affordable housing. And we have served on a local government task force on the topic, among other things. And also, as Carol mentioned, we invested $1 million to grant the localities for eviction prevention because we know housing stability is critical to community health. So with that background in mind, I'd like to introduce our distinguished panel. If each of you could kind of wave as I announce your name. I'd like to start with Roy Girardi. Hi, Roy. Thank you for joining us. Roy grew up in the Baltimore area and graduated from the University of Maryland. He's resided in Williamsburg since 1987, and he came here to minister to college students at William & Mary. He's currently employed at the City of Williamsburg for a little over a decade and serves as the outreach and crisis counselor. He essentially addresses the basic needs such as food, medication, and medical needs and housing, with a major focus on homelessness prevention and rehousing of residents in Williamsburg. Roy also pastors a church in the Williamsburg area, the chapel at Kings Mill. So welcome, Roy. Next up is Abbott Woodall. Abbott is the Housing and Neighborhood Revitalization Division Manager for York County. He is responsible for the county's Section 8 Housing Choice Voucher Program, Emergency Home Repair Program, Neighborhood Revitalization Projects, and First-Time Homebuyer Program. He began his career working for the Virginia Department of Housing and Community Development as a community representative, providing technical assistance and monitoring compliance on federally funded community development projects. He served as the executive director of housing partnerships for 14 years before going to York County. And he graduated from William & Mary and has a master's degree in urban and regional planning from VCU. Welcome, Abbott. Thank you for being here. And then there's Keith Denny, James City County. Keith has 40 years experience in commercial and residential construction and project management, including over 10 years in the US Army as a construction engineer serving in US, Europe, and Southwest Asia. Little over 7 years as a chief instructor of building trades for the Peninsula Housing and Builders Association in Newport News, and over 2 decades with James City County as a construction projects coordinator, and now as the Hope Housing Programs Manager. He serves on the board of directors for the Community Action Agency locally, which is referred to as ACE, and he's an active member of Lebanon Christian Church in Lee Hall. Keith graduated from Christopher Newport University with a Bachelor's of Science in Governmental Administration. Welcome, Keith. Thank you for being here. And last, we have Tom Tingle, who serves on the Williamsburg Health Foundation Board of Trustees. Tom has served over a decade as a member of the Housing Partnerships Board and has been involved in designing housing from low-cost starter and replacement housing to multifamily housing for over 35 years. He helped Housing Partnerships in the very beginning and worked with them through their warm and dry housing efforts in the late 1980s, all the way to their contemporary project called Powhatan Terrace, which is a multifamily project on Jamestown Road, excuse me. Tom is a licensed architect in Virginia and 8 other states. He is a Virginia Tech graduate. Tom joined Guernsey Tingle in Williamsburg, Virginia in the mid-80s when it was then known as Magoon Guernsey Architects, and he became an associate with the firm in 1985 and was named principal in 1986. Now he is president of the firm and he is responsible for the firm's strategic focus and business performance. So welcome, Tom. Thank you for being here. Okay. Now I'd like to toss it to each of you so you can tell us a little bit about your work and what you do in your day jobs to help residents in our community achieve stable, affordable housing so that we can learn a little bit more about you and your work. So Tom, if it's okay, I'm going to toss it to you first, please.
Thanks, Kara. I'll be glad to. I think you did a good job of kind of covering my background. In case the audience hasn't noticed, there's an imposter on this group. When I'm on a panel with Roy and Abbott and Keith, the person talking to you now has a whole lot less experience than those guys do. So I'm honored to be here. Many of my years on housing partnerships was with Abbott at the helm. So it's good to be back, and certainly have worked with Keith, not quite as much with Roy, but over the years in James City County. My other kind of extracurricular involvement doesn't look like it's related to housing. Spent 16 years on the James City County Economic Development Authority, been on comp plan steering committees there, been involved in the Business Climate Task Force, but so many of those issues that we dealt with when we're looking at economic development, when we're looking at workforce development, really goes back to housing. Do we have adequate housing supply? If not, what's the transportation situation? So all of it kind of feeds into affordable, safe, and that term warm and dry housing for residents. As a firm, we've done a lot of work around affordable housing. I will give full credit to My retired partner, many of you know Roger Guernsey. Roger continues to practice on his own. He had a passion for affordable housing. He introduced me to housing partnerships many years ago, and that passion kind of grew into the firm. Really, it's part of our DNA and our culture now. The variety of work we've done for housing partnerships over the years, as well as private developers, is still kind of, we're looking for that opportunity for affordability, whether it's in workforce housing or truly LMI affordable housing. So kind of been part of what we do for many years, and glad to be a part of this August group talking to you today.
Thank you, Tom. You used the term LMI. Can you expand on that a little bit for those of us who don't know what that term is?
Sorry, using the acronyms. It won't be the first one this afternoon, I'm sure. Low to moderate income housing.
Excellent, thank you. How about you, Keith? Why don't you tell us a little bit about what you do in your day job and maybe talk a little bit about LMI as well?
Okay, I'll give it a shot. So as Kira mentioned earlier, I'm the manager of the housing office. I've held this position now for 6 years, since 2016. Prior to that, I was the project coordinator, and I was responsible for our rehab projects, our demolition and replacement projects, flood mitigation projects, just a variety of residential construction related projects. Now, I still have my hands in that a little bit as we support the efforts of our community development team, neighborhood development team. They now apply for the community development block grants and manage the grants, and we still are responsible for rehab projects, new construction projects, and whatnot. But the big thing that I most valuable thing I contribute now, I guess, is the management of several critical housing programs. And I'd like to start with the in the order that I feel that is the most transitional for folks. And with the 8 other housing staff here, each of them having a unique responsibility and skill set, we now have an outreach coordinator, a position that we established and filled last December. And that person goes out on the street and meets with literally homeless citizens. We get referrals from citizens, the police department, other agencies, letting us know that there's someone who appears to be homeless, that he does homeless outreach. And so we have the ability through that program to bring literally homeless citizens into our shelter program. It's a program where we pay for hotel stays temporarily while we transition folks from the street to permanent housing through our rapid rehousing program. So this funding comes through the Virginia Homeless Solutions Program funded by DHCD. And we work with a lot of local partners: Williamsburg House of Mercy, 3E, United Way, Salvation Army, Avalon, and our own Department of Social Services. So that's a transitional program from the street to permanent housing. We also have our Housing Choice Voucher Program, commonly known as Section 8. In that program, we have regular Housing Choice Vouchers. We have 154 of those. We have 10 Veterans Administration Supportive Housing Vouchers for literally homeless veterans who we can provide a subsidy for permanent housing. We have a mainstream program for those folks exiting an institution or in a permanent supportive housing program or rapid rehousing program. We can issue them a voucher and bring them into permanent housing with a subsidy. And then we have a family self-sufficiency program. This is not unique to all programs, but it is a very successful and good program where anyone who is in our Section 8 program and has a desire to become more self-sufficient, they can participate in that program for 5 years. We started out with a mandate of 56 participants, and we currently have a mandate of 6. Of those, we've transitioned approximately 28 households from Section 8 to home ownership. And they do get an escrow balance, so a portion of their success goes into an escrow so that they can use those funds towards home ownership or whatever they choose. And then we have our home ownership program, which includes employer-assisted home ownership, down payment assistance through Home or Housing Opportunities Made Equal and the Greater Virginia Peninsula Housing Consortium. And then we have our rehab programs, which I've already mentioned some about those. All of these programs require that the participants meet the LMI requirements, as Tom mentioned, low to moderate income, some of them at 120% of the area median income, some at 80%, some at 50%, which is our Section 8 program. You have to be at 50% or below in order to qualify for that. And then for our homelessness prevention program, 30%, which is, it's ELMI, I guess you would call it, which is extremely low income, or ELI. And that's what we do on a day-to-day basis. We most recently, we had to prepare a report of outcomes from FY22, and we had, just from our normal programs, we had assisted a little over 400 households with 1.6 million in funding, federal and state funding, and then through the CARES Act, FEMA and other COVID-related funding, we had assisted another 339 households with $1.4 million, including the $430,000 that we received from the Williamsburg Health Foundation. So it's a like I said, critical housing assistance programs, a lot of need, and a lot of service provided.
Thank you, Keith. You mentioned AMI, which stands for Area Median Income. I know that depends on household size, but could you, just for the purposes of people on the call, give us a sense of what 50% of AMI or 100% of, just give us a sort of a, do you have that off the top of your head?
Oh, I have it right here on my cork board.
Could you just give everybody,
because I need that regularly. But yeah, AMI, so 100% AMI, the target range for that, everything is based on a household of 4, which is $84,500 for a household of 4. That's 100%. It doesn't mean that you're at the top of the income earning pyramid. It means you're in the middle, basically. So, median income based on the area. The Census Bureau defines household as at least one person. And for the purposes of this panel, some of the information I'll share later about AMI, I'm using the Bureau's, the Census Bureau's definition of family, which is at least 2 people. So to get a sense of that, a household of 2 or a family of 2 at 50% of the area median income is $33,800, and at 30% of the area median income for a family of 2, it's $20,300. Very, very low. So 30% is considered extremely low income.
Thank you. That context is very helpful. Appreciate that very much. How about you, Roy? Why don't you share with us a little bit about what you do every day? Oh, you're on mute.
I said I wouldn't forget to do that. All right. First, I just want to say again, thank you to the Williamsburg Health Foundation for their very generous grant. And it's very timely, and it has helped a lot of people. We'll talk about later, but I just want to say thank you. Very great. About 10, 11 years ago, the City of Williamsburg social work team was pretty overwhelmed with a lot of emergency situations, which was preventing them from doing their ongoing case management with adult services, adult protective services, and child protective services. So the director at the time, Peter Wallenfish, really felt like there was a need to staff another position and to kind of address the person who's in crisis who would be calling our office. And so I'm the emergency assistance coordinator, or I guess outreach and crisis, my formal title. I deal with emergency assistance, and my role generally is the first point of contact when someone's in crisis. Maybe their children got sick this week with the flu, they missed work, and that, how they can't pay hotel room rent. Sometimes they don't have enough money to pay for medication. We also help with food-related issues, transportation to a lesser extent. But the primary situation that I've encountered in my 10 years has been with housing. I would say every year I get between 500 and 600 emergency assistance calls, people coming into my office, and 80% of those deal with housing. So, we're talking, I'm dealing with every year about 400 cases that are just related to housing for the past 10 years. That's quite a few. And so I've been able to really, at the ground, grassroots level, interact with folks, find out why are you in crisis? What happened? How can we get you back on track? I typically address the short-term crisis in terms of if they are going to be homeless tonight, try to find a housing option. It could be paying their motel rent. It could be finding them a shelter. It could be an apartment. That's not, let's say, call that day with the eviction notice and so, but typically my role then at that point to assess the situation, I guess triage might be a good term for it, and then do the warm handshake, as Peter always used to describe it, a handoff to another agency. And one of the things, and someone I think, maybe Carrie, you mentioned it, or Carol, Williamsburg is an amazing community. So generous, so gracious, so willing to reach out. And there are so many great community partners that I've worked with, whether it's faith-based, you got House of Mercy, many churches in the Williamsburg area. We've got nonprofits like Salvation Army, which I'll go into more detail later, our partnership with them. 3E Restoration is a ministry reaching out to within our own agency. We have the care team, which I think some of you are with. So my goal then is to make that warm handshake and connect people to the next resource that can help stabilize them to root issues that they're dealing with. Well, and I'll tell you, just based on what I've been doing with the Health Foundation grant, talking about area median income, AMI, all the people who have almost, maybe a handful, not fall in this category, are way below the extreme category for AMI. I mean, 33,000 people is way more than most of the people I ever, way more than they earn. There's just a lack of livable wage for a lot of folks in this area. And I can get into more details on how we're addressing that too. But so we have the City of Williamsburg, the Williamsburg Housing Authority, which is public housing, is a separate department. But I work closely with them when we have the situation to find someone housing, teach someone who needs assistance. And of course, broader partners, which I think is a subcommittee, the COC, which helps rehouse people who are particularly vulnerable. So a lot of partnerships. Again, I do the initial assessment and then try to to a more specific long term.
Thank you, Roy. We appreciate that very much. And last but not least, Avit, why don't you share with us a little bit about what you do in your day job?
All right, you give me the hard job of following up Keith and Roy here. So they are both incredible partners, and I appreciate working with both of them on many of the projects that we all talk about. It's a very small community here. Like Keith pointed out, we have a lot of similarities between our two departments. One of our biggest programs is our Section 8 Housing Choice Voucher Program. We have 277 regular vouchers, 10 of the mainstream, which were those non-elderly disabled homeless specific vouchers that Keith mentioned. We have 4 VASH vouchers that we're currently administering at this moment, and that can vary depending on what the VA sends to us. And then we do have 40 emergency housing vouchers, which are authorized under the coronavirus response legislation. And it's for homeless and at-risk homeless individuals. So those are, that is a partnership between us and the GVPHC, which is the Greater Virginia Peninsula Homelessness Consortium, which is our local continuum of care. So both Roy and Keith and myself all participate in the COC and SCAN. Referrals are made, and they can make referrals directly into that program. We view those vouchers as regional resources, so we certainly want to take referrals from our both Williamsburg and James City, and we work closely with both Roy and Keith and their staffs to make those work. Beyond that, we do also have a first-time homebuyers program. We have one component of that is we can do up to $10,000 in down payment and closing cost assistance. And then we also are packagers for the U.S. Department of Agriculture. We have a loan program called 502 Direct. So we can get loans that are as low as 1% interest with 38-year terms, which enables us to make housing much more affordable for a lot of our first-time home buyers. There's some provisions to that. It has to be in rural designated areas. Surprisingly, all of Upper York is considered rural. So the Williamsburg portion of York County is rural, but we'll go with it. Our emergency home repair program, again, similar to Keith, we do have an emergency program where we do try and keep people housed. I couldn't get away from my housing partnership roots of emergency home repair. We use a lot of both internal county funds and then grants, and then also USDA 504 loan grant combinations to make the whole package work. Last year, we were able to put $234,000 into our emergency home repair program through a conglomeration of different programs and grants and funds. So we're really proud of that. We have our neighborhood revitalization projects. We do write and administer CDBG projects throughout the county. The most recent ones we did Barlow Road a few years ago. Actually did that when I was at Housing Partnerships with the county. And then more recently, we've been working in Carver Gardens for the last several years. We are thankfully coming to a close on that. We've been out there a number of years. We put just about $3 million in federal funds into that neighborhood and have rehabbed 54 homes and then rebuilt an additional 3. So we're really proud of that project and getting ready to start transitioning to our next project in the coming months. And then we also do some catch-all things that because we have some experience in grants, particularly CDBG, we did write and are currently administering a regional economic development business assistance grant for both Williamsburg, York County, and Poquoson. We just got another grant award. So that is $3.83 million in small business assistance. So it's not housing, but it's, most of these businesses, the vast majority are small minority and female-owned businesses that we've been able to assist. I believe it's over 70% at this point. And many of their employees are the same population that we're working with. They are the LMI population. So you know, we want to house them, but we also want to make sure they continue to have economic opportunities. So we're doing a little bit of that as well. That's us in a quick nutshell.
Well, thank you very much, Abbott. You know, it's really clear to me that, you know, collectively you all represent decades of dedication to the housing sphere in our community, and we're grateful for that. And it's really interesting to hear about the variety and the volume that you all work with every day. So I appreciate that background. And now I'd like to kind of pivot and talk about sort of the reason that we're gathered here in terms of talking about housing in general. So normally for a panel discussion, I like to start with the big picture and then drill down into Health Foundation programming and grant making. But today I'm going to flip that and start with the grant that Carol and I mentioned earlier, really so that we can check in on the progress of that grant and provide an opportunity for our board members to ask, or anybody to ask questions. And then we'll go to the big picture to get your expert opinions on housing affordability in our community in general. So specifically about the grant, the eviction prevention grant, I mentioned earlier that our focus is more on advocacy and not necessarily making grants for the provision of housing services or for rent subsidies. But at the time that we made the grant as a foundation, it seemed like an urgent and appropriate response given the enormity of the pandemic and the ability for the Health Foundation to step up and fill that, that gap. In the summer of 2020, when we started talking about this opportunity, the pandemic was still new, and it was clear that all of us, local governments included, were extremely worried about what everyone predicted would be an eviction crisis. So we researched the topic and recommended to our board a $1 million investment in eviction prevention in partnership with the local governments. And the board approved that cluster of grants to the local governments. At the time, we didn't know about the federal and state resources that would eventually flow into the system. And so part of that is what we'll talk about today. The grant began in January of this year. And in July, the City of Williamsburg, James City County, and York submitted a 6-month progress report for the COVID-19 eviction prevention grants that represented what had happened in the first 6 months of the year. And collectively, the localities at that time had assisted 73 households with approximately $200,000 collectively, which is roughly an average of $2,700 per household. Because of the additional resources from the federal and state government that flowed in, and because of the eviction moratorium, funds were not expended as originally predicted. And so at that time, there was roughly 80% of the grant was unspent. And so before I toss it to Tom to talk a little bit about this grant from the board perspective, I do want to comment that this partnership has been a really heavy lift on the part of the local governments. The people on the call today, Abbott, Roy, and Keith, have worked tirelessly to talk with landlords and make sure that they're making the connections to make sure that that the resources from the federal and state government are used first, and that that our money is sort of a safety net of the safety net, if you will. But it has been a tremendous amount of work to get the word out and make sure that everything is in good order to use the funds as they were expected. But with that as background, Tom, I was hoping that you could speak for a minute as a member of the foundation board about why you felt like this grant was an important investment. If you could speak to that.
If I may interrupt, Tom, I'm so sorry, just before you start. We've had a couple of technical issues, and so I've sent out a couple of logistical messages in the chat box. So if you don't mind, periodically, folks on the panel, could you check your chat box and just respond? Thank you so much. Sorry to interrupt.
Not a problem. So to your point, Kira, and Carol's point, you know, yes, it was a very big grant and a very unusual grant for the foundation. You know, it's going back to the summer of 2020, where were we and what were we thinking, and you know, how did we decide this was the right thing for the foundation to do? You know, if you look back there, as Kira said, we had no idea what was going to be flowing down from the federal government and where we would be in eviction moratoriums. But it generated a whole lot of discussion, a lot of healthy debate by the board. I can't remember, since I've been on the board, maybe Doug and others that have been there longer may remember similar grants, but certainly not in my time. But this pandemic affected the working poor, the frontline workers, the hospitality workers, transportation, the small businesses that Abbott was describing, those folks that own those businesses and work for those businesses. And obviously, if you don't have a roof over your head, it's going to be extremely difficult to get access to healthcare. So we saw pretty quickly that this was not just a potential housing crisis, but going back to the Williamsburg Health Foundation and our mission, it was also a potential significant healthcare crisis. I certainly can't speak for the other board members, but what got me over the hump, what really got me starting a little more comfortable with this was the three localities that are represented on the call today. One of the measures the foundation uses for its more traditional grant process is the effectiveness of its partners in delivering programs and services. So we knew we had quality, effective city and county staff who could execute these grants. And frankly, that made it a little easier for us to say it's the right thing to do, because we're certain that the funds are going to get to the right people that need them the most. And I'm sure if you asked any of the other trustees, Kira, you would get maybe different answers, but hopefully some common themes too.
Well, thank you. And at the end of this, we certainly will have time for everyone to chime in. And of course, there's the chat box, as Carol mentioned. So comments and questions are welcome in the chat box. So as we alluded to, the grant did not necessarily go as expected. And since the 6-month report has been submitted to us, there's been some time has elapsed. So I'm going to ask Keith to talk about his perception on how this grant has gone. Has it gone as you expected? And it's totally okay to be honest, Keith. We're among friends, so just talk to us a little bit about whether you felt that this grant has gone as you anticipated it would.
Well, then being honest, no. And we anticipated, and I guess part of our anticipation was based on the common theme that the sky was falling, and or that the tsunami was coming, or that the flood was going to overtake us with evictions, and that did not seem to happen. Every month we would brace ourselves for the eviction moratorium ending, and then the flood of applications in need, the flood of calls. But every month the moratorium got extended over and over and over, and the flood didn't come. With the Health Foundation funding, as Kira mentioned, we were asked to use that as a last resort, and we did have another program, almost a mirror of, or I guess I could say that the Health Foundation grant, the rent assistance program, was a mirror of the one that we had with an urgent need grant that we had already received from the state. And so we've assisted 35 households through these rent assistance grants. 10 of them were through the Health Foundation grant, and 25 or 26 through our urgent need grant. So what we had done is, when we would receive a call, we would initially qualify them for our urgent need grant. And then if they needed ongoing assistance, then we would qualify them through our Health Foundation grant and provide additional assistance. If they didn't really have a legitimate COVID connection, or they were already behind on their rent before COVID and didn't have that COVID connection, we would refer them to one of the other local or state programs that was available either through the United Way or the rent relief program at the state level. Yeah, I guess the short answer is no, it didn't. The need wasn't as great as we anticipated it being. And I will say also the number of evictions that we anticipated did not occur. There was one of the largest apartment complexes that we have in our area. I sat down with the property manager there, and he said that the state program was a godsend because once they opened the door for landlords to apply on behalf of their tenants, since they have those tenants right there in their complex, and this happened in other apartment complexes as well, I just haven't talked to all of them, they were able to put notices on the tenants' doors. They were able to open their door and allow them to come in and provide the necessary documentation, and then they applied on their behalf. It was a lot more than just us acting on the behalf of tenants, but there were a lot of other resources available, which is great.
Thank you, Keith. That's very helpful. So I guess the next question is, have you seen anything change since you submitted your 6-month report since June 30th? Roy, you want to take that? Have you seen anything change? Has this speed picked up, or is it pretty much the same as the first 6 months? Oh, you got to unmute. Is that working? No, I can't hear you. No. Okay. Why don't you keep trying, and then.
And is it better now?
Yes. Yes.
Clear. Okay. She said it was kind of hard to understand. How to do the phone. Not good for someone who's not good with technology. But yeah, I think your question was since June.
Has anything changed? Has the speed of applications picked up? Have you seen anything shift?
Right. No, I would kind of echo just what Keith said. There's been a drop off. To give you a perspective from our situation, from the inception of the grant to the end of June, we had 60 requests, and since then we've had 13. So that's a 75% drop, practically. And it's, again, it's hard to know. I just anecdotally, I know there's one apartment complex, they actually hired someone. I mean, it was kind of overwhelming for the managers from when I talked to apartment managers to just do their job and have this on top of it to help people apply for assistance. So I think there's so many different things going on, but I mean, some people that weren't getting help came to us, but then the moratorium bumped back, and I think they were looking, it'll just be bumped back again. So I don't think the sense of urgency was there. But now, like this one manager, they actually hired someone whose specific job is to just have people come in and apply for the state relief program. We have someone in our office who's designated for that as well. But again, I don't, maybe a lot of these folks, well, I will say this, I just talked to one manager today, and I said, so how are things going at your community, and are many people behind? Because Wendy and I visited several apartments about 2 weeks ago just to kind of put the word out there again. And all of them had very minimal, maybe 1 or 2 people or 2 units behind. But then I just talked to this manager today, and she says she has a stack of 40 to 50 people at her desk that are behind significantly. So, I think the need is still there. It's just if the moratorium is going to stick this time, which I'm assuming it will, but who knows?
Thank you. Thank you. Abbott, can you just outline kind of in a, sort of 101 primer fashion, what other dollars are coming to the community, like why things change? Can you explain the federal and state dollars just so, really briefly, so everyone understands why the landscape shifted a little bit and where those funds are coming from?
Well, I mean, other than the rent relief program, which is huge, and the money they've poured into that is just, I mean, none of us could have predicted the amount of money the federal government has poured into this program. You know, I know Keith has mentioned his CDBG project that James City County administers. So, you know, they were very fortunate in getting that early on and have had that as a resource. And then in addition, we also have the United Way. They have their eviction reduction pilot program that covers all of our jurisdictions, and they also have resources that was funded through DHCD as well. So, you know, when you throw all that together, it's really, you know, we're very fortunate that, I mean, none of us could have foreseen the amount of federal money that was going to flow down. And, you know, that's what saved us from having to really dip into the Health Foundation funds in the manner that we originally thought we were going to need to.
Yeah, if I could just add one thing, Kara. What I noticed too was initially folks that would qualify, you know, that the Health Foundation grant would address, because I think the idea was 3 months behind. Many individuals put that off. So then once they're out 6 months, 7 months behind, you're talking, that's a lot of money. And $7,000, $8,000, $9,000, $10,000. Thankfully, that's kind of where that, because boy, they'll go back to March 20th. You can document it, and then pay 3 months forward. So I think that was part of what was driving it. People were putting it off, and then they almost needed more assistance than the Foundation grant could do.
Thank you. That's helpful. So we've been talking a lot about the other money that's been flowing through and how things didn't necessarily work out as we thought, but the grant has helped some people. And so I would be helpful if you all could maybe each share one story, case study to just illustrate to everyone on the call the type of household these funds have supported and helped. If you could just each tell a story that came across your desk so we could get maybe the human side of this grant. So why don't I start with you, Keith, if you could just tell a story to everyone about what, just maybe a household, that'd be great.
Lost my cursor there for a second. I know that we did submit a story or a case study, and it was a family, a household with a young child and the father, who was a truck driver, or aspired to be a truck driver, had lost his job and was working to get his CDL so he could get a job as a truck driver. And one of the things that being able to catch their rent up and pay them going forward allowed him to continue to pursue that CDL license without fear of his family being evicted. And then he was able to successfully get a job as a over-the-road truck driver and be able to provide for his family. So it was that cushion for them while he was in between jobs and working on trying to complete that. I will say, though, this isn't a case study, but I think one of the greatest successes that we've had out of this effort has been with our landlords. Because what it did is it put in place, as we developed our application and talked about one of the things that we would do, there had to be some provision in the agreement that the landlords wouldn't just turn around and evict the tenants if we got their rent caught up and started helping them going forward. So having that agreement with the landlords that they wouldn't do that, it opened a door for us to have a conversation with landlords about not just that there's 6 months worth of assistance, 3 months of past due rent and 3 months going forward, but also educate them on other resources that are available and ask them to consider those and to not evict their tenants, but to come back to us again after that 6 months is up and see what else we can help the tenants with. I think just making landlords aware, either our corporate landlords or our private landlords, that we're here to help. This isn't just a shot in the arm, but there are other resources available that we are connected to. Just give us a call. You know, if you're the first line of defense for those tenants, you know when they're struggling, you know when the rent's late, you know before anybody else when there's a problem. Give us a call and ask, is there something more you can do? Because there are other programs and we can connect you up. We can help the tenant walk through the application process. As long as you'll work with them, we'll work with you and try to help as much as we can. I think that's one of the good outcomes of this effort.
Wow, thank you for sharing that. That's really tremendous. And I do hope that those relationships continue beyond the pandemic and beyond the grants so that we can maybe prevent eviction moving forward. That's great. Thank you. How about you, Roy? Do you want to share a story about a family you helped, or household rather?
Yeah, sure. I mean, I think it's one story and it could be put out many times, but this, I think, is a classic picture of what the Health Foundation was hoping to accomplish and did accomplish. This was a single mom, which is typical of these scenarios, with 2 children, a 10-year-old and a 12-year-old, working in the service industry as a housekeeper. And, because of the pandemic, she found her income, it wasn't a whole lot to start off with, get reduced more than 50%. And so when you're barely making it, you can imagine what a 50% hit does. So of course she was several months behind when she completed the app, when she was able to submit the application. And the great thing is, what we can do, this kind of is the initial reason why they come to our office, is for help. But then we can do an assessment, as I mentioned earlier, and figure out what other wraparound services we can provide and what other ways we can assist. And so, when she came into my office, of course, we started the application, and then we connected her to our social work team and benefits team. She wasn't receiving SNAP benefit, and that was something that she could apply for. We were able to come alongside her, and her English was limited and challenged, so it was especially helpful for our social worker to come alongside and help her gather the documents that we needed for the application. And as a result, we were able to knock out her past due rent, and we also connected her. We have someone who helps with employment services. So really kind of wrapping around that person and trying to help her get reestablished. And she was able to kind of get back into the job force after a couple months and be able to afford her home again and have that sufficiency. So it was a great story of how this grant, I think, really wanted to work.
Thank you very much. How about you, Abbott? Do you have a story you'd like to share with the group?
Sure. I think one that we're proud of and excited by is a 66-year-old woman. She and her husband living here in the Williamsburg area in York County, and unfortunately he contracted COVID and passed away. So she lost her main source of income. She had been assisted with the rent relief program when the United Way was managing it, and they paid for rent through the end of December of 2020. We were able to help cover 3 months of her rent, kind of help buy her a little bit of breathing room. And now she's actually, as of today, I just found out, been approved through the first-time home buyer program and is going to go out and purchase herself a home, which will be cheaper than her rent. So Very exciting. Kind of to the point that both Roy and Keith made, that, bringing people in who may never have reached out to us in the past and letting them know about the different services that are available. If there's any bright side in this terrible pandemic, it's that, we're able to make some connections that we never would have made otherwise. So, we're happy about that one. Anytime we get a success and move someone from rental to home ownership, we feel good about it.
Thank you. Those are great stories. And I do, I'm looking at the clock, and I do want to pivot a little bit, as I said at the beginning of this conversation, to that larger picture and about the importance of affordable, stable housing in general. So if it's okay with all of you, I'd like to kind of tap into your knowledge around that. So Tom, I'll start with you and ask you to reflect, given your investment in the topic over many decades, if you could just reflect on why housing is important to community health and why you think it's an important topic for us to elevate for a community discussion. Could you just reflect on that for a little bit?
Sure. I think the impression with some is that we have a housing crisis and healthcare crisis because of the pandemic. And in my opinion, all the pandemic did was expose a lot of the weaknesses in the system. People are already living on the edge. You've heard about some of those from these guys. They have limited access to healthcare, quality food, transportation, obviously quality housing. When you're living paycheck to paycheck, you just don't have the savings. You don't have access to funds that you need if something, one thing goes wrong and it all kind of falls apart. The blessing that we have is the foundation came through with this grant, federal government, state government. There's an infusion of cash in the system right now, but we're not going to get back to everything being healthy again. And I really believe that the housing gap is widening. Land prices, environmental requirements, the cost of construction, the general appreciation of the real estate, that's continuing to go up. And I realize we're in a state that's committed to raising the minimum wage over the next few years to hopefully a healthy living wage, but that gap is going to continue to widen. The price of homes in the greater Williamsburg area is going to go at a higher rate, increase at a higher rate than that minimum wage will address. So I think you're going to continue to have difficulty in the folks that we're trying to serve with healthcare, finding the available dollars for healthcare, finding the available dollars for healthy food. So I see it right in our wheelhouse as a foundation and as a community that we need to keep our eye on.
Thank you, Tom. So we have a chat and a question in the chat about in terms of affordable housing, particularly for those in the tourism industry, are we meeting the need? Are we falling behind? And so my next question, I'd like you to incorporate that question into, you all talked a little bit earlier about the work that you did and you quantified some of the voucher numbers that you have and the people that you assist in a variety of programs. But if you could maybe quantify the affordable housing gap in your locality using a metric or statistic of your choice to just demonstrate the scope of the problem, I think that would help our board members understand. So I'm going to start with you, Abid. Is there anything that you could share that would just kind of illustrate the scope of the issue and whether we're meeting the need or falling behind?
Sure. Well, I think because of our Section 8 voucher program, I'm very aware of what rental prices are in York County. In an ideal world, we'd love to see everyone to be homeowners, but realistically, to the point Tom made, it's not going to happen. Not everyone's going to be able to afford a home here, and homeownership is not the right fit for everyone. The challenge is the rental market in this area is so tight. One, there's not units available, and if you can find them in one of our affordable complex, this isn't a complex that is not subsidized, does not have tax credits on it, but just a regular market rate apartment that we do a fair bit of our Section 8 units in. A 1-bedroom, 1-bath apartment would require someone to make an annual salary of $43,200 to qualify for a 1-bedroom, 1-bath. Same apartment complex, if you are a single parent with a couple kids and you need a 3-bedroom, you need to have an income of $63,000 to qualify. This is not a new apartment complex. This is not a ritzy. This is a, you know, mid, lower level apartment complex in the county that we've worked with for years. So, you know, you're not going to find much cheaper rent, and that's the disconnect when you're looking at, you know, I know everyone likes to point out the teachers and the firemen, but what about the teaching aides and the bus drivers and the home health care aides, the folks that, you know, we may have a little over 300 vouchers. That is not a drop in the bucket to meet the need of the demand. So how they qualify to live in these apartment complexes is just, it's a challenge.
How about you, Keith?
Yeah, I agree with that, but I'm looking at the Out of Reach 2021 Virginia study that was done. It's a web-based tool, and it has a lot of the same data. You can pull up two localities side by side in York County and James City County, although the populations are a little different. The data is pretty much the same. And moving on down a little bit, if you make minimum wage and they're using $9.50 an hour as minimum wage in our area, you can afford to pay $494 a month for rent. And as Abbott mentioned, $960 is for a 0-bedroom or an efficiency, and $972 for a 1-bedroom. So you only make half enough money to afford that. The other information that I wanted to share, as far as the gap that I see, we often hear, most often we hear that the gap is a lack of affordable housing, and that may be true, but I think it may be more accurate in the case of renters to say that there's a lack of housing affordability, meaning that there's enough housing for our renters. They just don't have the money to be able to pay for it, as we just mentioned on the income discrepancies. So out of that study, it shows that James City County has 28,920 households, and of those, 24% are renters, 6,827 renters. And of those renters, hopefully you can follow me on this, of those renters, James City County has 210 subsidized households. That's how many households we assist with our Section 8 program. And that's only 3% of the renters. So it's a very small portion of the renter population that actually gets a subsidy. And to qualify for a subsidy, you have to earn 50% or below of the area median income. And again, for a household of 4, that would be $42,500. And it costs, HUD's standard for households is, for a household of 4, you have to have a 2-bedroom unit. That's the minimum. And a 2-bedroom unit is you need $45,880 worth of income to afford that. And again, the area median is $42,500, so it's less than what it actually costs. So just to put that into perspective just a little bit, if you can still follow me with this, and this data is projected data from the 2010 census. So they project out to 2019. And using that data, I have pulled out 2 examples. James City County, based on the data, has approximately 594 extremely low income families. And again, I'm not using households, I'm using families, which is 2 persons or more. So I'm basing everything on a 2-person household and the area median income for a 2-person household. So we have 594 extremely low income families. That's at 30% or low, or 30% or below. And then we have 1,185 low income families, and that's at 50% or below of the area median income. And again, if you look at that together, that's close to 1,700 families that would actually be eligible for Section 8 at 50% or below. We have 210 vouchers that we can provide subsidies with. So if there's almost 1,700 households or families that are eligible for the program, and they can't even afford to rent enough housing to house their family size, where do they get the money? Like Abbott said, how do they even afford to live in the apartment complexes that we have? Extremely low income, again, for a household of two, that's $20,300. And to just get a one-bedroom apartment, you have to have $38,800. Where does the other $10,000 or more a year come from? Well, it comes from not having a car, not having insurance, not having childcare, not having enough food to eat, not paying for your medications. That's where the other $10,000 comes from, because all of their income goes towards rent.
Thank you very much. I feel like I needed a PowerPoint slide for that one, but I think the upshot is that less than 20% of the people who need a voucher are getting one. Is that in the
it is. I apologize for
no, it's good. No, it's
data and no images to go along with it.
No, but no, it's very profound and eye-opening. I don't know, Lou, if that's getting to answer your question, but if it isn't, please type in the chat. And then Roy, how about you? Is there any data or information you'd like to share that kind of quantifies the scope of the issue in the city?
Sure. One of the, I got this from the Virginia Department of Social Services Office of Research and Planning. And just Williamsburg, in terms of poverty rate relative to other, Williamsburg's poverty rate is 18.2%. For the eastern part of Virginia, it's 11.4, and for statewide, it's 9.9. So the city of Williamsburg proper has twice, what the poverty rate is for the state of Virginia. And there's two things I wanted to mention in addition to and maybe addressing this question from Mr. Rossiter as well, is one of the other challenges is often folks that are living in motels, some at one point had an apartment, but they lost the apartment, and then they started incurring a judgment. And often, what just is a deal breaker right from the get-go for some folks is they have a $3,000 or $4,000 judgment on their credit report that the apartment complex won't even consider until they eliminate that. Well, how in the world are they going to eliminate a $4,000 judgment when they're barely making enough money to even stay afloat? And so, that addressing that. I mean, I was just on the phone with a lady today who, has the apartment complex told her, we could offer you a lease today, but you have to keep this judgment on your report as a deal breaker. And the other thing too is, and I know this is not as I guess it's more complex, but to be honest, there are non-financial factors that play into the inability to afford housing. And what I mean by that is you'll find individuals that, and I see this in our public housing, because of substance abuse issues, family relationship issues, they either lose their job, or I'm working with this one family where they were together in an apartment, then the couple split up and the husband moved out. And he's trying to cover himself, but also help pay for her apartment, which is noble, but it's just difficult when you're working on an income. And this is my third point, is so many of the jobs that are out there, the service sector jobs, housekeeping jobs, certified nursing assistance jobs, a lot of these heart and home and care and home provide, they're so unpredictable. Someone can have a client one week and they're working full time, and then that client dies and they don't have someone to replace. And so they have no job all of a sudden. The serving industry and housekeeping industry is a little bit more predictable that they can say, okay, the summer's over, business is going to drop off. And then, of course, in January, things even drop off more. But so we need to kind of address those issues of getting people out of those service sectors. I don't know. Those jobs are needed, but they're just not sufficient for families to make it on.
Well, thank you all for sharing your wisdom with us. I'm looking at the time, and so what I'd like to do is, now that we're sort of all sufficiently depressed, I'd like to pivot to sort of a more aspirational perspective. And if we could take the last 15 minutes, the last actually just a few minutes, so we can allow time for everyone to turn their cameras back on and ask questions. Each of you could just take 2 minutes. And just, I'd like to ask that, my favorite question is the magic wand question. And if each of you could wave your magic wand to change one thing around housing in our community, it could be a project or a policy or jobs or, whatever you think, but just only one thing. If you could just kind of inspire us and give us an example. I'm going to start with you, Abbott, and that way you can take everybody's good idea.
That's what I was going to say. Please put me first. Don't put me at the end. I don't want to go after Keith and Roy. No, well, it's easy to say, well, more money or more resources, but I think for me, what would be the most impactful is with a magic wand, if we could change people's attitudes, the NIMBYism, where, just the absolute, immediate rejection of anything that says affordable, subsidized housing, because to serve the populations that we need to serve, there's only one way we can do that, is either tax credits or some housing choice vouchers or some subsidy layering in there. And the challenge we have, even though the fair housing law in Virginia changed to add source of funds as a protected class, it's been a huge, huge benefit to all of us who have voucher programs and who try and place some of these families. Still, I mean, and this is me, not the county speaking, there is some hesitancy when affordable housing projects come forward, and particularly, but even multifamily in general, there's some hesitancy at a local level and from neighbors and residents. So if we could overcome that, that would be a huge benefit.
Thank you. Okay, so no more NIMBY. How about you, Roy? What's your magic wand solution?
Yeah, I'm glad I can follow up quickly. I didn't want to depress people too much. Actually, I can end on an encouraging note, and it's probably been the thing that I've enjoyed most in the past 11 years that I've been working with in the city, and it's our partnership with the Salvation Army. The city of Williamsburg, at one time we had 4 transitional housing apartments, now we have 3. And the transition housing apartment program, I was thinking initially, when you asked this question about magic wand, I was thinking of, okay, judgment assistance and car repair and hopefully car purchase, greater availability of childcare. And I was thinking of all these issues. And then I realized the transition housing program that we've had with Salvation Army in my involvement for the past 11 years helps address that. Real briefly, someone can move into a family can move into an apartment and their rent and utilities is entirely covered. So that immediately takes off the housing stress. But there's a very intense, I'll call coaching. And it's not just once a month you check in with the person for 15 minutes on the phone. This coaching comes into the home and helps the person address all these issues. As I said, there's underlying issues. Sometimes they don't have even the high school education. And so this 2-year program allows them to work on their GED, or it helps them to work on getting a certification in HVAC or something else that leads to a better paying job. And this has happened, I've seen it happen in the program, it's just not theoretical. It helps because when the person doesn't have to cover their housing and utilities, and they work maybe they're working 3/4 time, because they're addressing other issues, they can save money to pay off their judgment that's been holding them back. And they can save money for a deposit on a home. And so this program helps address those other issues. And we've seen folks, this one lady was legally blind. She had one child. She was in our program. She was homeless when she came into our program, and she was able to get into one of the a program, I think, that Abbott was mentioning about helping her actually buy her own home, because she was able to save money. She was working at William and Mary, but she was able to address these peripheral issues that were holding her back. So magic wand, I would love to have more transitional housing apartments in the city of Williamsburg. I wish we could quadruple it or even more. But I think it's a very effective program to address these.
Right, so we're going to get rid of NIMBY. We're going to have transitional housing for anyone who needs it. Now, Keith, what are you going to add to that solutions list?
Well, I actually was handed a magic wand recently. I was hoping to talk about that. But if I had a magic wand and I could change one thing, whether it be a project, a policy, or an investment, or whatever, it would be an investment, and the investment would be in people, and it would be investing in changing their hopes and dreams and peace of mind and health and overall sense of well-being, and that would be done by taking away some of the stress and strain and burden they have from not having enough money to pay for the things we talked about earlier. And to do that, I would provide a subsidy, just like our Section 8 program, to those struggling households, so that it would make up that $10,000 a year. Maybe it would be $200 a month or $300 a month. But it would allow them, and we do have 4 HUD certified housing counselors, so it would allow them, in exchange for receiving this subsidy, they would be required to participate in an FSS-like program, a family self-sufficiency type of program where they set goals. In the front end, the goals would be pay off their debts. Because if we're going to help you with your rent now so that you have freed up income, let's use that to relieve some of the burden. Let's get some of the debts paid off. Let's establish good credit. Let's establish a budget. Let's put some of that money away and work our way towards a point or a period where we can become more self-sufficient. And then we can move our families out of the situation that we're in. We may be living in a hotel, which is not an ideal environment for our children. We may be living in a high crime area. We may be living in a neighborhood where there's no grocery stores. We may be living too far away from emergency medical assistance. We may be living too far away from our children's schools. We may be living too far away from our job, and all of those things are costing us money. A gallon of milk doesn't cost $3.40 anymore. It costs $4.80 because of the gas that you have to drive all the way to the other end of the county to get your milk and come back. You don't buy fresh vegetables because you only do that once a month because it's so far away. 7-Eleven doesn't sell that. But that's what I would do. I would provide the subsidy for households to take some of that stress and strain and burden off of them, so that they could start getting their lives together. And once they've done that, addressed their credit issues, saved up some money, got a good budget in place, then they could relocate into a new zip code with better schools and a better environment, safer environment, a better socioeconomic situation for their family, for their children. And, you know, we all know that if you can get out of the situation that you're in into a better situation, your children don't usually look back at that situation. They look forward at the one that they're in because you have just moved them forward. It gives them hope. I mean, I can talk a lot more about this, but I know we don't have time.
Yeah. We'll set up another time, Keith, because I want to hear that. But
Kira, you got to give me one chance to take a swing at that one. even though I'm not a house
you're bringing up the rear, and we're gonna turn everybody's camera on, and Lou has another chat and question in the chat. But yeah, Tom, so no NIMBY subsidies and transitional housing for everyone who needs it. So what do you got?
I'll be very brief, and Abbott hit half of it with the not in my backyard issue. And I see Crew Trivet stepped off, so I won't offend him. But Barb, this is not just for James City County, but across the board. We have got to have better policies that allow for more multifamily. We have got to go vertical. We cannot solve this problem with small single-family detached houses that all get home ownership, as Abbott pointed out before. You know, I'm working on a project right now in the city of Hampton, townhouse style, so everybody understands what that looks like. I've got a density of 20 dwelling units per acre, which is very high for townhouses. The cost of the land is $30,000 a unit. The cost of site development is $30,000 to $40,000 a unit. So before I've even started building a house, I've got $60,000 to $70,000 invested. So we have got to think more vertical. Other cities are doing a great job of this. And I realize we're not Seattle, we're not Long Beach, California, we're not Atlanta, but the only way we're going to solve a lot of these problems is to provide more product, and that's going to have to be higher density.
Thank you. Thank you all very much for your participation. I'm going to toss it to Carol now, who's going to facilitate questions and ask everybody to turn their cameras on.
Thank you, Kara. So I will ask everyone and invite you to turn your cameras back on, turn your audio and your videos on. And if you have other questions, please feel free to ask those. We did get another question from Lou Rossiter in terms of, for those of you on the panel, how does having the Eastern State Hospital and the Peninsula Jail in our community impact your work, affect your work? Can you speak to that at all?
I would say for me, the hospital doesn't have much of an impact. I will say, you know, usually every month there's someone from the regional jail that's released, comes to Williamsburg, that's looking for assistance, housing assistance, so forth. So it's not a steady stream, but yeah, I definitely get cases from the jail, but not really Eastern State.
Abbott or Keith, anything from your experience?
Well, I would say the closing of some of the institutions in the area and the reduction of funding for some of them required that a lot of folks with maybe intellectual or developmental disabilities were turned out. And so the state under the Department of Justice did require that the localities absorb those folks. We were only able to absorb 2 with our Section 8 program, but we regularly circulate those vouchers. We get referrals from the Department of Behavioral Services, and we know that there's more of a need, and one of the impacts that we have from folks who may be in jail, they may be in jail because of substance abuse or violent behavior, domestic violence or something like that. And we do have the intellectually and developmentally disadvantaged folks who often get discharged from the institutions. That said, we have a mechanism in place to assist them, but it's often much more difficult because of the barriers that they bring with them. So it requires that we put a lot more effort into aligning with landlords, what we call second chance landlords, for our hard to serve populations or our hard to house populations. So it's a much heavier lift when it comes to those citizens. And we do have folks that get released from jail. We do have folks that have some of these other disabilities and barriers. So it's a lot of work. The good thing about it is we have partners in our other resource agencies who work with us to assist in those barriers that we may not be skilled to assist with, or have the tools or resources to assist with. So we rely on a lot of our local partners to help with that, and they do.
That's great. Thank you. We have another question in the chat. What are the prospects for more low to middle income independent or assisted living facilities in our area? What do you see the potential for that being developed?
Can't specifically speak to the assisted living facilities, but we have seen some interest in the independent living, the LMI senior properties, if you will. The tax credit properties that we've seen approved in York County tend to be in that regard. So that seems to get through the approval process for us. So we have one that was approved that's working. And they've been received a tax credit allocation award. They're just working through some design issues. That's Upper County near the hospital, which is a senior tax credit facility. And then we also have another project that is underway that is also going to be a middle income independent living. So same people who did the arbors at Town Park, which is a really nice facility. They're doing another project over across from Busch Gardens. So you know, we're seeing a little bit of that, not so much the assisted, the higher level of care, but I think that gets some traction locally because it doesn't quite frankly have the children aspect and the added services that come along with that. It seems like it sails through approval process quicker.
Thank you. Other questions? Please feel free to unmute your line and ask away.
This is Jack. I'd ask the same question to James City and Williamsburg.
Well, in James City County, I don't really have any information to share that's on the horizon as far as assisted living. Senior complexes, we do have Parker View Apartments, and Bay Aging has had conversations about the possibility of doing another because the demand is so high, the waiting list is so long. They have had conversations in the county with myself and others from community development about the potential for doing another project. I can't tell you that there's a timeline for that, but there is interest in it, and it's for another senior apartment complex.
I'm not aware of anything in the city at this time.
All right. Well, are there any other questions? Well, I would like to just make one comment on something that Keith said earlier, which I think was an unexpected outcome, at least on my part, of this process. And that is your relationships that you're building with the landlords. And I'm sure all of you are. I mean, I think we tend to see in the press and perhaps even in our own mind's eye sometimes, the landlord is the evil one who is without any regard throwing people into the street only to be, you know, collecting the next renter's money as fast as they can. And I think it's easy to forget, especially during the pandemic, that, you know, without people paying the rent, the landlords aren't getting the income that they need either to keep their heads above water or to keep their maintained or addressing issues that may come up like a burst water pipe or something else. So I really appreciated that comment, Keith. And I think that it's probably a huge benefit to the landlords to feel like they aren't public enemy number one, that you're reaching out to them and saying, hey, there's resources here. You'll know faster than anybody where the needs are. And so come to us and let us know what's going on so we can try and find other resources, if available, to help this tenant that you're struggling with. That's got to just be hugely beneficial to the big picture as well as to that individual landlord and ultimately to the tenant that you're trying to help. So thank you for being aware of that and for sharing that comment, because I thought that was very, very insightful. Well, thank you everybody for your time this afternoon. I have found this very interesting, very helpful to get an insider's perspective on the things that you're dealing with, the challenges that you're facing, and some of the terrific outcomes that are coming out of your work. So thank you so much. Tom, thank you for joining us as our board member expert in this process and for all the great questions that came up. We look forward to seeing all of you again at our next panel discussion, and we will let you know when we have that one finalized and ready to come out. So thank you, everybody. Kira, any last comments that you'd like to add before we start?
No, just like to extend my thanks as well. Thank you, everyone.
All right. Have a great day, everybody, and enjoy your week. Take care. Bye-bye.
Thanks all.